I request Dr. Viveka sir to start his presentation. I would request Dr. Sarath Gopalan to be present here. Where is Sarath? Do not disappear into the crowd. Here, please be seated here. And you can watch sir's presentation because I would like to have your perspective on this very important molecule. Friends, ladies and gentlemen, welcome to CME number 885. Just before Dr. Viveka sir starts, I would like sir, Dr. Viveka sir to felicitate Dr. Vimal and Dr. Shireen. Dr. Shireen, please come here. Dr. Vimal, please come here quickly before the plant is donated. You are lucky you are being felicitated by Dr. Viveka sir. What one plant? अगली बार से टाइम पे आना डॉक्टर श्रीन. Yes sir. Sir, thank you so much.
Well, so good evening, friends. At the outset, let me thank Dr. Chauhan for bringing the, what our grandmother used to tell that this is wonderful product. So I think everyone has used and especially in northern part of India, this is something which is really considered to be something very good for, not only for your heart and diabetes, but also overall well-being and abdominal diseases are also less when you take appropriate amount of Fenugreek extract. So Fenugreek is something which is meaty and so if you look at the advantages of this plant and the seeds, it is the advantage in diabetes and cardiovascular disease management as well. So let's look at the epidemiological data. So everybody knows, and I think in this forum we have discussed many a times that how diabetes is a big health burden on our country, and over 75% of Indian patients with type 2 diabetes have got inadequate glycemic control, that is HbA1c is either equal to or more than 7%. So it means that our population is, they are getting diabetes at a younger age group and they have got much more malignant form of diabetes. So meaning thereby that apart from the, good lifestyle, the appropriate diet intake is also very important, and this product is something which is very important in that. If you look at the uncontrolled diabetes, we always say that the diabetes is mother of all diseases, so most of the cardiovascular disease and all would happen because of diabetes, so hypertriglyceridemia. So many patients will come to us and they say that, Doc, I have done the lipid profile, my triglyceride is very high. And they haven't done anything else because they presume that they are non-diabetic. But I always tell them that, look, if your triglyceride is high, you must rule out diabetes. They say that, no, I don't have diabetes. But when you do the blood sugar, HbA1c and all, you find that they are in diabetic range. So rising triglyceride is a very common problem where people have got early onset of diabetes, even in pre-diabetes. And then, of course, there will be insulin resistance, adipocytokines will be, abnormal. So there is an atherogenic dyslipidemia. So this common soil of, diabetes resulting into cardiovascular disease is very, directly correlated. Almost 62% of people who have got diabetes, their death is because of the myocardial infarction and coronary artery disease, and not because of the diabetes-related issues. And those who get diabetic nephropathy, that is diabetes-related kidney disease, they have got even more risk of cardiovascular death. So we need to control the basic enemy, that is diabetes. So insulin resistance, the free fatty acids and adipose tissue, liver metabolism of this, and triglycerides. All these things would lead to hepatic stimulation. So in our world, we see that every other person is having fatty liver. So that is nothing but more carbohydrate-rich diet. I think today Dr. Chauhan is serving only proteins. So if you eat proteins, you will be healthier. So if you look at the diabetes, there will be increased VLDL, so lipoprotein little a, FOP, secretions and all goes up, and that is again a risk factor. And especially in Indian subset, we have been seen that data after data shows that if the triglyceride is high, in Western population it is not so much of a risk factor for cardiovascular disease, but in Indian population, if you look at the paper from INAS, there is enough data to suggest that triglyceride beyond the range of 250 would cause significant coronary artery disease. Of course, if it is more than 500, then pancreatic disease and all would be more common. So we need to work on this, what we call residual risk. After controlling LDL, there are a lot of patients who would have cardiovascular disease, and those patients who would have hypertriglyceridemia. So we need to control that, and the basic problem in them is the pre-diabetic insulin resistance and all. So if you see the Indian subset there, the triglyceride is something which is very, very important contributing factor. But when the good news is that if you control the triglyceride, there are few trials which have shown that if you control triglyceride aggressively with molecules like icosapentathine, then there is a reversal or reduction in the plaque burden. So that is one of the few studies which have shown that if you control your triglyceride, you can reverse the plaque morphology as well, and the total plaque burden reduction will also be there. So hyperglycemia and vascular disease go hand in hand, and one of the reasons is that because of this milieu, there will be continuous hyperglycemia would lead to low-grade inflammation. So remember that sugar is most, what we call intoxicating agent. This is something which is more, people become more physically dependent on sugar than morphine. And a lot of people would say that morning I have not taken my tea, but it is not the tea which you are missing, but it is the sugar which you are missing. So the sugar is something which is a very, very high-grade inflammatory agent. So people live longer if they don't take white sugar. The more refined sugar you take, the more higher the risk of cardiovascular disease is there. So this low-grade inflammation is, we have learned from the COVID era that the COVID was the highest form of inflammation, and that caused sudden increase in coronary atherosclerosis, narrowing of the blood vessels. But if you take sugar, then slowly over the period of time it will cause atherosclerotic disease. So it leads to arterial stiffening, hypertension, and diabetes is considered to be a very, very strong risk factor. So risk of cardiovascular disease in diabetic patients is very high. The prevalence of cardiovascular disease in patients with diabetes is 21.1%, but as the age advances, the atherosclerotic cardiovascular disease was the cause of death for 70% of patients with diabetes. So you can imagine that the global data is only 62%, but if you look at the Indian data, 70% of patients would have cardiovascular disease, resulting into the cause of death in patients who are diabetic. So prevalence of difference between cardiovascular disease in diabetic patients, if you see that all vascular diseases, so they will behave something like similar. So the patient would have coronary artery disease 9 to 75%. Stroke would be again 25 to 30 to 53%. Hypertension contributes 42.1% risk factor, and peripheral vascular disease in 7.6% of the Asians. So we have data from this Journal of Clinical Physiology also that management of diabetes dyslipidemia in Indians, and that recently we had a consensus statement from the Cardiology Society of India also, and that showed that 90% of Indian patients with diabetes are estimated to have dyslipidemia. And Indian patients with diabetes have an aggressive course of atherosclerosis, and aggressive treatment for diabetic dyslipidemia is needed to prevent the atherosclerotic cardiovascular disease. So basically, once you have the disease onset, then you need to be on multiple medications to decrease apart from the lifestyle modification. So cardiovascular risk in newly diagnosed type 2 diabetes patients in so what we call typical Indian dyslipidemia, where you see that the HDL cholesterol, that is a good cholesterol, is low, LDL is not very high, but the triglyceride would be significantly high. So that is something which is causing more problems, because by conventional wisdom you try and not to give them cholesterol medicine because the LDL cholesterol is normal, but what we call residual risk is very high in Indian population. So we need to look at the optimal lipid lowering treatment, and that leads to significant cardiovascular risk reduction in patients with type 2 diabetes. And that is why at one point in time there was a guideline that any patient who is diabetic or even pre-diabetic, we should be treating them with statins or any other agent to decrease the cholesterol and even the triglyceride. So at one point there was a data that we should be giving everybody who has got diabetes, to protect from the cardiovascular disease and stroke, we should be giving them aspirin. But the data from 5,000 patients in as per trial that will show that the patient who have diabetes alone but not a proven cardiovascular disease or not a proven cerebrovascular disease, there if you give aspirin in everybody, then it is a counterproductive. But statins or lipid lowering agents are something which is very, very important and will decrease the risk of cardiovascular disease. So American Heart Association also scientific evidence that shows that if you look at the hyperglycemia and glycemic targets to decrease, there is 37% risk reduction in over a period of time of almost 10 to 11 years, and also stated that dyslipidemia is central to comprehensive cardiovascular risk factors control of cardiovascular risk reduction in adults with type 2 diabetes patients, meaning thereby that one of the reasons why you might ask that why diabetic patients are having more cardiovascular disease, the simple reason is that they are by and large heavily dyslipidemic, and that is the reason. I had a couple of days back a patient who was just 39 years of age. He was a non-smoker, but he was a diabetic at a young age and had a significant triple vessel disease and to do triple vessel angioplasty. But at such a young age, because he had an onset of diabetes as when he was just 27, and at the age of 40 he had a significant triple vessel disease. So we need to control, and this is a metabolic disease. So quite a few of patients would come to me, so few of them are 78 or 79. So today I had a patient who was 79 years of age, and he did not need, wanted to have a bypass, so I had to put 5 stents. His daughter comes to me and says that, doctor, he eats very well, he goes for exercise, plays golf, he's very good at his exercise, and why did he get a blockage in heart artery? So so I always tell them that, look, God doesn't want us to live beyond 100 years. So if you get heart disease or blockage in your arteries, either heart, brain, then it is just the aging process if it happens after the age of 75 years. But if it is happening at a younger age, maybe if somebody is getting at the age of less than 60 years, then it is purely risk factors or what we call the lifestyle disorder. So cardiovascular disease has been labeled as a lifestyle disorder if it is happening in age less than 60 years. Of course, exception is genetic, so if both parents are having cardiovascular disease, it will happen at a younger age. So if you are having very high carbohydrate diet, which Dr. Chauhan always instructs that it should not be served, And of course, the tobacco and smoking is second highest risk factor. But you need to control your diabetes. So either your grandmother was not very strict that take more methi in your food, because this is something which, so we'll come to that later. But again, it has been seen that the other metabolic factors like vitamin B12 deficiency and all, that also contributes quite a lot for these things. So if you look at the fenugreek extract, that has got quite a few active ingredients, and where is my chairperson?
Sir, here.
Yeah, so as Dr. Chauhan already declared that I am ignorant about all these, fenugreek extract, but when he sent this, I did not remember, because whenever Dr. Chauhan's phone comes, that you have to do a CME without thinking or without blinking an eye, I say, okay, go ahead. But I don't ask about the topic, I don't ask about the things. I said that okay, because again he will start explaining me about the molecule, how many person will come, the venue and all those things. So I say, okay, I understood, go ahead. But I did not, remember that I have said yes for fenugreek extract, which many years back, my grandmother used to give me when I would get chest pain, I get sick. She would say, this is something which is Ramban, it will work for everything. So then, while coming here, I was told that it is CME about fenugreek extract, and this has been packaged in a capsule called ICBEX CVD, isn't it? So, it's a miracle product. It has got anti-diabetic properties, hypoglycemic effect, dyslipidemia, reduction is there, it is an antioxidant. So, it means that it is something which has got multiple, so it's a very, very talented molecule. So, if you eat every day, so that is why if you see, so my grandmother used to say that if you have to eat non-vegetarian, you must take with this methi or what we call fenugreek extract, because it nullifies the bad effects of all these things. So all those old memories started coming back to me thanks to Dr. Chauhan. So it is having anti-diabetic effect of this thing is that, complex carbohydrates, alpha amylase and maltase, they are simple sugars. So something which is very important. So what the methi or this fenugreek does, it suppresses this enzyme to make it so complex carbohydrate remains complex and does not get absorbed. So when we say that, what is harmful in your food, so harmful thing in your food is which has got a very high glycemic index. High glycemic index means that whatever you eat, it immediately gets absorbed. So we need to delay the absorption. So one of the tricks is that you eat a lot of green salads and make a layer in your tummy and in your stomach and all, so that these products do not get absorbed suddenly. So like you remember the ad that a person who becomes very tired comes and drinks a Glucon-D, that is the highest form of refined sugar, and then immediately it gets absorbed and feels that as if you have got energy. But if we get something which slows down the absorption of sugar and carbohydrates, that would be wonderful drug. So that is why methi is given, or fenugreek extract should be taken with these high calorie things, so that the absorption is slowed down. So the glycemic index of the food can go down significantly, and you do not have high sugar, or even the high cholesterol will not be there. So it slows down the digestion and absorption of the carbohydrates, leading to a more gradual release of glucose into bloodstream. So if we can eat diet which is slowly released, that's the risk of high sugar and type 2 diabetes and hypercholesterolemia will not be there. So we need to, that is where this fenugreek extract would work. So it has got a phosphofructokinase activity, efficient utilization of glucose to produce the energy. So anti-hyperglycemic action of fenugreek extract is, this is how it has been shown that it is really very, very impressive. It also improves the insulin secretion from pancreatic beta cells, modulates the action of glucon like peptide 1, delays the gastric empty and slows the carbohydrate absorption and decreases the sodium dependent absorption of glucose by the intestine. So it means that in one sentence we can say that it decreases the glycemic index of food, even if we, so when you are going for party or on every Wednesday, each member of this physician forum of India, while before coming here, take this, so that your absorption of the carbohydrate and the protein becomes slower. So anti-hyperglycemic action of this extract is that increases the number of insulin receptor and improves the peripheral glucose utilization also. So, and it's not just something where it is a postulation. It has been shown in ICMR study also that it was shown in this that it improves the glucose tolerance, glucose utilization at the cellular level. It means that, so if your glucose utilization is good and the glucose tolerance, so you don't get hyperglycemic after taking food, it means that the overall risk of diabetes will be less. Also, the effect of fenugreek on hyperglycemia, this also shows that, this was again a paper which showed that it decreases the fasting blood glucose and also the HbA1c level and postprandial also. The reason being that it makes your food a low glycemic index food. So how does this extract work on cardiovascular disease? So accelerates the cholesterol metabolism. It also processes of the reverse cholesterol transport, produces the large micelles that cannot be absorbed and bring down the triglyceride and LDL level. Decreases the amount of primary substrate for triglyceride synthesis. As I said, the hypertriglyceridemia is something which is very dangerous and people have not really recognized. But if you see the data from the, something which decreases the triglyceride level, that has shown that it has a power of reversing the blockages in the heart arteries or vascular system. So inflammatory and oxidative parameters are decreased. Antioxidative parameters, it increases the satiety and reduces the body weight also. So you feel that you have eaten enough so that you don't eat further. So it decreases these fasting and postprandial glucose, also the 3 months average glucose by virtue of that, and significantly improves the cholesterol profile, and not only the total and LDL cholesterol but also HDL cholesterol becomes more positive and improves the overall glycemic control parameters and lipid profile safety. So there are studies which have shown that randomized controlled clinical trial evaluating the effects of fenugreek versus glibenclamide. So this is an oral anti-hypoglycemic agent in patients with diabetes. So if you see that this fenugreek seed for diabetic, it is something which is very, very helpful. And comparative evaluation of glibazide and fenugreek seeds as monotherapy and combination therapy on glycemic control and lipid profile in patients with type 2 diabetes mellitus. It has been shown that when you compare with OHA, the lipid profile does not significantly change, but when you take the fenugreek extract monotherapy, you have a very, very positive lipid profile. It means that the lipid levels would be positively affected. So fenugreek extract as monotherapy or add-on therapy is proved to be useful agent in treatment of type 2 diabetes with or without dyslipidemia. It means that if you want to control diabetes, so it is good for diabetic people also and patients who are non-diabetic but are dyslipidemic, there also it is going to work. So effect of fenugreek is not only on fasting blood glucose, but also on 3 months average glucose, waist circumference, body mass index, blood pressure, and quality of life. It means that this is something which is really, really good for all these things which people pay millions of dollars to achieve. So if you see the effect of this fenugreek seeds on oxidative stress, we always say that we need to be, decreasing the oxidative stress, and this is some, product which has got a very high anti-inflammatory activity and nitric oxide activating effect. So it means that it can really be very helpful in these situations. So people know that in modern world you won't like things if they are served on plate saying that this is old Indian product. So it has to be encapsulated and given in a capsule form at a higher cost so that you accept it. and you value it. So if something is given free of cost, you may not value it. So that is why this ICBX CVD contains all of these, but top of the list you can see Fenugreek extract is something which is top of the list, and it is combined with coenzyme Q patient with type 2 diabetes. So we have seen that a lot of patients who have got statin allergy, muscular pain and all, there also it is very helpful in those situations because of its antioxidative properties, and also supplementation with coenzyme Q in these patients are also, when we give the statin therapy coenzyme Q, but also Fenugreek seed extract makes things much better and your diabetic control. So I have got quite a few patients where they have done extensive lifestyle modification, oil-free diet, Fenugreek, and then of course the Arjun bark and all. And there is a type 2 diabetes reversal. So at one point in time, we were thinking that somebody who has become diabetic will not be non-diabetic and not needing any medication, but that's not true. The power of lifestyle modification with these kind of things would make them non-diabetic, and they are for more than 5 years non-diabetic. So obviously the power of lifestyle modification and all is something which is really, really good. So if you see the data that this is something, so these products would decrease your fasting and postprandial and HbA1c levels, and also the lipid profile will become very, very friendly. Total cholesterol as LDL cholesterol will be lesser, triglycerides will be lesser, and HDL will also. So the chromium supplementation improves the glycemic control and lipid parameters. So these people have included that also inside Lex. So the zinc supplementation has beneficial effect on glycemic control, promotes healthy lipid parameters, and remember the zinc also has got a very, very strong anti-inflammatory. So it helps in healing of the bones and all. It will also help in healing the plaques as well. So the beneficiary role of selenium also is proven beyond doubt. So they have given selenium also in this product. Vitamin B12, we all know that it is the most important coenzyme for most of the metabolism in our body, so that is why it has also been included. And this study is just not a concept, but studies have concluded that multivitamin use was associated with lower risk of cardiovascular disease events, so that is why they have included in that. To conclude, friends, I would say that it improves the blood glucose control and diabetic parameters. Fenugreek extract would be something which contributes heavily when you take this molecule. Improves the diabetic dyslipidemia and cardiovascular risk. Improves nutritional vitamin and mineral deficit in diet-restricted diabetic patients. Supports management of that may help in reduce the anti-diabetes. So if you take with coenzyme Q, it makes it even more effective. It prevents the statin-induced myopathy, with a lot of patients who would complain muscle pain and all. Those things will be taken care of. And of course, the support diet-based metabolic control will also be helpful. So if you have come to this CMA, I think they are giving one capsule for everybody who has come here. IBX, CVD, and if you see how fast Dr. Chauhan is coming, running around, the secret behind it is nothing else than ICBX, CVD. Dr. Chauhan. Thank you very much.
बेटा पीछे से ऑन करना लाइट को बेटा ऑन नहीं है बेटा एक मिनट अभी ये लाइट बेटा ये हटाना बेटा हाँ
I would request Dr. Viveka sir and Dr. Sarath Gopalan to be seated here.
इसको बंद कर दो।
डेविड, डॉक्टर विवेका ने लिया। इनकी फोटो मत ले, इसकी फोटो मत लेना, मेरा ऑडियंस की या ऊपर कर और एक कंसंट्रेट हो। ओके, can I just request you to have some decorum? Dr. P.K. Gupta, I give you the responsibility of keeping everyone quiet at the back. You are the in charge. And I give Dr. A.K. Bhalla the responsibility to keep everyone quiet at the back table. So I want these two gentlemen, the tallest stalwarts from the Physician Forum of India, to keep decorum at the back. This was a very important topic, and you can understand that many of you were very interested in the various qualities and cardiac health benefits, glycemic benefits, oxidative properties of Fenugreek. And now we have a product actually from Pharmet which can serve these purposes. I would request all of you to ask your questions, but I would start the ball rolling. And Rajiv, I'm sure you are very much interested. Can you
सीट नहीं है इसलिए खड़ा।
नहीं, can you give a chair to Dr. Rajiv Ade, please? And Rajiv, can you give a drink to Dr. Rajiv, please? And to Madam also. Madam is accompanying Dr. Rajiv. Please take care of them. Please take care of them. Sir, I would set the ball rolling, Dr. Viveka, sir. Sir, you mentioned about pre-diabetics. I will come to him, sir. About pre-diabetics. Sir, do you think that we should start Fenugreek in all the pre-diabetics?
So non-diabetics also we should start it so that they don't become pre-diabetic.
Okay. Sir, have you been using Fenugreek in your cardiac patients? And are you taking the wisdom from your grandmother and passing on to your patients?
So I think it's a disclosure. I've been using it since I was a child. So it's like you in our kitchen. Right from my grandmother to my mother, it's been a tradition to use Fenugreek, and whenever we use something which is high calorie stuff, so we call it chunk of this Fenugreek and then start. So I think it's been really, I would say, finding the old things which are so good tradition and everything. And we need Dr. Sharad scientific inputs to prove that those things were really scientifically correct. So I would say that these traditions were not just a fluke, they were really helpful. And it's been seen that we use those practices, right from the millet to Fenugreek and all those things, they have coming back. Because we were thinking that we are fools, our old tradition were not good, and we were trying to take the Western culture. But when you look at the scientific inputs and all, then we say that our old tradition were really the gold standard, and we need to go back to that. And I would invite Dr. Sharad's research-based data on that. But we have already put a disclaimer that I don't know anything about it.
Thank you, Dr. Viveka. First of all, let me tell you, I'm with you. I'm a hardcore clinician like you. And I'm a pediatric gastroenterologist in an adult forum. And I have two of my other pediatric colleagues here, Dr. Ashok Chakravarti and Dr. Sunil Sehgal. And I'm fortunate that I started my career in India after coming back from UK with Dr. Ashok Chakravarti sending me my first patient in 1996 in clinical practice, and I never looked back after that. And I wore multiple hats after that, because after 25 years of clinical practice, I got an unexpected offer from industry at a global role to join as a medical director. So I've had some experience with product development in industry, which is something which you will never get in clinical practice. And now, after having come back into clinical practice, I'm wearing another hat as National President of Nutrition Society of India for the past 3 months now. So with this background, I just wanted to bring up some facts. If you look at the natural fenugreek, there are seeds, there are leaves, and the whole plant. Every part of the fenugreek plant has benefits. But from a practical standpoint, it's the seeds and the leaves. Seeds and the leaves. So when you're cooking, if you're wanting to add fenugreek to any cooking item, please add the seeds first, because they need to be boiled and denatured initially before it gets absorbed. The leaves in a dried form can be added right at the end. These are the recommendations, that they can be added right at the end. Now, I would like your input, sir. I really appreciate that. We've had a very healthy discussion, Dr. Saab and I. Now, here, some data worldwide is there on fenugreek, but if you look at the natural form, the earliest studies on fenugreek in India is one of the largest exporters of fenugreek. So if you look at the earliest studies, right from 2004-2005, nearly 20 years ago, Dr. Krishna Swami and I started the studies here. And they did a huge study where they did 100 grams of fenugreek, defatted fenugreek seed powder. That is, fenugreek seeds were powdered and in a defatted form. They were given to adults. This is an adult study, not pediatric. Adult study. And they looked at, over a period of 10 days, what's the effect. They found that fasting plasma glucose, fasting plasma insulin, and overall glucose tolerance improved within the first 10 days. But between the 10th and 20th day, there was an additional benefit on lowering the total cholesterol, lowering the LDL cholesterol, and also the serum triglycerides. So this was an added benefit which is not in the first 10 days. After that, they made a recommendation that, I mean, this very old recommendation I'm talking about, I'm going back to history. So 25 grams of natural fenugreek seeds, if they are added to the daily diet of a diabetic individual who's undergoing treatment, medical treatment for diabetes for type 2 NIDDM, it will benefit the overall response. That it may help in lowering the requirement of the other drugs and will help the diabetologist in the overall treatment. So this was their recommendation according to the publication 2008. Which brings us to a central issue. Today, the tablet which is available is 300 grams of 300 milligrams of concentrated fenugreek extract. Now, according to those recommendations, if you look at the international recommendations of natural fenugreek, it's 5 to 10 grams per day for the normal individual who's non-diabetic. But for a diabetic individual, 25 grams per day along with your standard diabetic treatment is supposed to be the right norm. But
He can talk.
yeah, sure.
Very good.
I'm not an expert on diabetes. Let me be very clear. I'm a pediatric gastroenterologist, he's a cardiologist, he's a diabetologist. So I'm nobody here. But this is what I'm quoting literature. I'm just quoting literature. So here, at the end of the day, 300 milligrams of concentrated extract, is it equivalent to 5 grams for a normal person? Or is it equivalent to 25 grams for a diabetic individual? This is, I don't know about this. This is what I would like to know from somebody who's using this in regular clinical practice, because in pediatric gastro, we seldom need to use fenugreek in day-to-day clinical practice. But this is important. So is 300 milligrams of the extract, which is used as a standard treatment, as a capsule, is it equivalent to 5 grams for a normal individual 5 to 10 grams, which is the recommendation, or is it equal to 25 grams for a diabetic individual for day-to-day practice? So this one thing. The other important thing is, from a natural standpoint, fenugreek seeds and fenugreek leaves. Fenugreek seeds are rich in 3 nutrients: protein, fiber, and omega-3 fatty acids. Fenugreek leaves are rich in beta-carotene, from which you get vitamin A, calcium, magnesium, selenium, potassium, and vitamin C. So, if you are deficient in any of these nutrients, you have to decide what you want to use, but by and large, fenugreek seeds are better than fenugreek leaves in terms of potency.
Yeah, thank you for your perspective, Dr. Sarat. Dr. Viveka sir is a great fan of the Indian traditions, and I took my uncle to him for atrial fibrillation, and he wanted to know whether he could use Arjun ki chhal. And I thought that sir is going to shout at me and him also about, and I was so pleasantly surprised. Sir said, no, you use Arjun ki chhal, it contains cardiac glycosides. Sir, I wanted to know from you, are there any other plant products that are supportive of hemodynamics and other molecular dynamics in diabetes apart from fenugreek? Why I ask you this question is because we keep hearing of jamun and jamun ki gutli and jamun extract and the kali jeeri and neem products. So any idea, any input on that?
So disclaimer is that if you are healthy products, from next year you will start getting that. So top of the list is Karela, which is considered to be anti-diabetic. Then of course the jamun, as you said, the extract. So they have been, so I was in BHU, that is Banana University. So there was a department of Ayurvedic pharmacology, and there are a lot of products which has come like for peptic ulcer, and also the banana-based product for peptic ulcer, the Arjun bath. The reason why I told you, uncle, to take this, that we have a lot of data on Arjun bath, protecting cardiovascular disease, decreasing the risk of strokes. In fact, we had a Ayurvedic department and the modern medicine, and the patients would go for a lot of things which were available in Ayurveda. They would not, the modern medicine would not match, like for colorectal fistula, and also we have got much better treatment for that. So I would say that there are a lot of plant-based products which are superior to the modern medicine, but of course we need to have the best of the both worlds, and that is something which is, I think so my father had a trick. I never used to take more, these, very bitter tasting vegetables and all, like, bitter gourd and all those things. But he would say that, the more bitter it tastes, the more benefit it will give you. Bitter is better. So the same thing I have, translated into my patients, that they say that, doctor, I have done angioplasty, but my hand or my leg is paining. I said, no pain, no gain. So the more pain means that it is going to benefit you more. So similarly, these are the products which are considered to be very beneficial. So those who are antioxidant, they will benefit you more. But there is a lot of data on Arjun bark as well, the cardiovascular benefit is concerned. For anti-diabetes, is all antioxidants, so fresh foods and all those things. So we always say that if you take more fiber, means uncooked, raw vegetables as your green salad and more fruits, the fiber would decrease not only cardiovascular disease but also diabetes and the gastroenteritis. So I think this is something which has to be taken. So we need to inculcate more green salad. So I will request you to have a menu for green salad.
Sure. Sir, we have we have a lot of gynecologists here. We have Dr. Shireen, we have Dr. Kiran, and we have Dr. Bansal also here. And Dr. Sarla Sharma also. I wanted to know you, I remember from my childhood sir, हमारे गांव में जब कोई पार्चुलेशन का केस होता था, डिलीवरी, तो उनकी मदर इन लॉ जो है उन लोगों को मेथी के लड्डू बना के खिलाती थे सर, जो कि बहुत ही कड़वे होते थे. And I remember my own delivering and my grandmother making lot of methi ke laddu and me chewing them during winter, and I got addicted to them. Any benefit of in women post birth?
आप पे कोई इफेक्ट हुआ?
No experience. Just I'm coming. I'm coming, sir. Dr. Anna has a question.
Some Fenugreek extract. I've been using this product from 2001. There was a company by the name of Kerala Healthcare. उनका एक प्रोडक्ट आता था इग्नेटर. याद है भाई आप लोग को? नहीं? अभी भी आ रहा है इग्नेटर ED. So I'm a sexologist and I'm practicing from 2001. खाली मैं बस खाली सेक्स ही करता हूँ और मुझे कुछ आता नहीं है.
नेक्स्ट ही करते हैं.
This was the main product which I used to prescribe. But somehow there was some problem with the manufacturing team by the what you call it research people. तो उन्होंने इग्नेटर को हटा दिया. But now they are having इग्नेटर ED. इग्नेटर ED में क्या है? फेनुग्रीक एक्सट्रैक्ट है, आर्जिनिन है, और भी कुछ चीजें हैं. मैं सारा एक्सप्लेन नहीं कर सकता. बीके सेक्सोलॉजी देयर आर सम, हमारे पास कंसर्न्स होते हैं डॉक्टर के ऊपर कि हम सारी चीजें डिस्क्लोज नहीं कर सकते. बट जब भी आप फेनुग्रीक एक्सट्रैक्ट को यूज करते हैं, डेफिनेटली ये आपकी डायबिटीज में हेल्प करता है. व्हाई? क्योंकि जब भी ये काम करता है, ये आपके पिट्यूटरी ग्लैंड पे काम करता है. FSH, LH, प्रोलेक्टिन को कम करता है, टेस्टोस्टेरोन को बढ़ाता है, ह्यूमन ग्रोथ हार्मोन को बढ़ाता है, SHBG को बढ़ाता है, सेक्सुअल फंक्शनलिटी को बढ़ाता है, मेटाबॉलिक डिसऑर्डर को बढ़ाता है. अगर मेटाबॉलिक डिसऑर्डर बॉडी में है, दैट मींस दैट द पेशेंट इज हैविंग डायबिटीज, उसको फर्क पड़ता है. यस, उसको फर्क पड़ता है. तो दिस इज वन ऑफ द बेस्ट प्रोडक्ट्स. आप देखिए, आप कभी भी किसी भी आयुर्वेदिक वाले को, जब कोई भी पंडा आयुर्वेदिक वाला ना, वो क्या कहता है कि आप मेथी के बीज सवेरे भिगाओ, उसको खाओ. भाई करता क्या है? पहले तो ये तो सोचो, भाई आप डॉक्टर हो, अगर आपके पास एक पेशेंट आता हो, कह रहा सर मैं सारी दवाएं खाई फर्क नहीं पड़ा, लेकिन मेथी के बीज खाए मेरे को फर्क पड़ा. क्या करता है? इट वर्क्स ऑन पिट्यूटरी ग्लैंड. ये क्या करता है? ये हार्मोन्स को ओवर स्क्रीन कराता है और आपकी FSH, LH प्रोलेक्टिन को कम करता है. क्योंकि मेल्स में अगर FSH, LH प्रोटीन कम होगा, टेस्टोस्टेरोन बढ़ेगा, सेक्सुअल फंक्शनिंग बढ़ेगा, ओवरऑल मेटाबॉलिज्म बढ़ेगा. तो दिस इज वन ऑफ द बेस्ट प्रोडक्ट्स बाय फॉर्मेट. रियली मैं आपको कह रहा हूँ, आप लोगों ने बहुत बढ़िया प्रोडक्ट बनाया है. अगर रियली में इसमें फेनुग्रीक एक्सट्रैक्ट है, ये काम करेगा.
Thank you, Dr. Anna. Any comment, Dr. Sarath? Any comment on Dr. Anna's comment that it is a good product for sexual dysfunction because it works on the pituitary gland, it decreases FSH, LH, increases testosterone.
It's also absolutely right. The effect is much more on males, and from the standpoint of increasing plasma testosterone. And there's a particular component, dioptin something, there's a name, which is the actual component which makes the difference in increasing the testosterone levels. So it's been better studied in the male population than the female population. So your point is very valid and absolutely taken. Also in females, in those with menstrual cramps and dysmenorrhea, it's been found to be very, very useful. Okay. Outside my area as a pediatric gastroenterologist, but yes, definitely.
ठीक है, वो सर ऑलरेडी बता चुके हैं पेट के लिए बहुत काम की चीज़ है, तो आपका फील्ड सर ने ऑलरेडी कवर कर लिया है और सर ने अपना फील्ड कवर कर लिया है. इट इज़ अ वेरी गुड एंटीऑक्सीडेंट. सर ने अपना फील्ड कवर कर दिया है. एंड द बेसिक टॉक व्हाट अबाउट इट्स गुड इफेक्ट्स इन डायबिटीज. सर ने कहा होमा यार कम करता है, फास्टिंग प्लाज्मा ग्लूकोज को कम करता है, पीपीजी को कम करता है, HbA1c कम करता है और इंसुलिन रेजिस्टेंस को कम करता है. वो सर ने ऑलरेडी बता दिया. या डॉक्टर Modar has a question. I hope it benefits some of the surgical conditions.
No. So if, anyway, Dr. Sarath, you are listening, Dr. Viveka. So if it is given to a diabetic, and if we, with oral hypoglycemic agents, should you monitor blood sugar more frequently? Because if it lowers the blood sugar, then it may cause hypoglycemia if you are giving normal dose of anti-diabetic. So should you monitor blood glucose more frequently?
Dr. Poda, the published data says the effect is very, very modest.
Okay.
It's very, very modest. In any way, you will be monitoring the blood glucose when you do diabetes, diabetic management. Dr. Sushil knows better, I don't deal with diabetics. But the effect is very, very modest. Any dietary intervention compared to a drug, the effect will not be huge. I mean, it's just to add as an adjuvant to the basic drug treatment. So,
there is no danger of hypoglycemia.
Not at all. Not at all.
इतना कम नहीं करता भाई.
I'm sure there must be. Yeah. Doctor, I am coming, sir. Ladies first. Dr. Rajani first.
Thank you. Sir, actually, by an Ayurvedic colleague friend, for my knee pain, I was recommended curcumin, fenugreek powder, and ginger powder. A mixture I was making and having. But then, you know, like Ayurvedic people say garam, thanda. So I just want to know whether it has any effect on metabolism, any acidity and all, because like during summers I have stopped taking it. And though you said it works on the muscles and probably it is antioxidant, so it would help in knee pain also. But any missing instructions on taking it, whether it is to be taken after food, whether it is going to not to be taken during summers or anything, because 25 grams is quite an amount.
That's an interesting question, Dr. Rajani, because
25 gram you are
Let me just mention, and before Dr. Sarath replies, there are now capsules of curcumin extract available. There is a simple way out. You could just take the capsule, ma'am, and not bother with making all the.
We have so many combinations.
Yes, ma'am.
One will have curcumin and selenium, other will have only fenugreek and zinc and something else.
Yes,
So
ma'am.
it's very difficult to know now.
I know, I
There's so many
understand. Do you
products.
have an answer?
no, I think you've answered it beautifully. Because you have to look at a practical solution to a drug. In fact, the data which you're talking about curcumin, not only curcumin and ginger, but also turmeric. All three together. Curcumin, turmeric and ginger. So his solution is
No, but I
about
asked
that.
about empty stomach, any contraindications, any time.
Ma'am, my own wisdom says, do not take ginger empty stomach. This is my own wisdom. Doctor, we'll go to Dr. Gurmeet Bansal.
He's irritated.
Hello sir. We have been using this fenugreek extract for improving the lactation, and because it improves the insulin resistance, we have been started using PST2 patients also. And I don't know whether how that we have the shampoos also available now by the name of Fenugreek. How that helps in hair loss local.
Ma'am, but when you give it, how do you give it? And do you give it?
Ma'am is saying that we have fenugreek shampoos available.
Okay, only for shampoo.
Yes, and does it help? I think we should wait for Dr. Levi Gupta to return from US. Yes, honestly. Yeah.
Yeah, about
a shampoo, it is actually having an anti-inflammatory effect. So those who are having
about Fenugreek helping in dandruff.
Yeah.
There's evidence that Fenugreek helps in dandruff.
Yeah. So if inflammation is the cause,
Dandruff may help.
inflammation is the cause, it may help. Sir, I want to boast here. I am the only one who have been using all these indigenous things. Ye saunf, ilaichi, adrak, ajwain and methi for more than 55 years. आप कहेंगे 55 ईयर में अब भी लगता है इतना टाइम 2 लाख का ही। तो मैं बहुत छोटा सा था, मेरी दादी नानी के मुझे नुस्खे अभी तक याद है, मैं अभी तक यूज करता हूँ। So we were talking about some other plant based products. We missed berberine, guargum, and other some Zincona products. So they are very good. So I'm a fan of all this. I've used this Hycibex and I found it very good. I myself use my on my own. Yeah. It has just come, but I have just used for 3 weeks. So I was provided samples and it's wonderful. So I am in favor of using these products. They have wonderful product benefits and we will discuss in our camp. 15 benefits I know, we may add to that. So anti-inflammatory is one which is most important. And of course on being fiber rich, it has effect on glycemia and lipid metabolism and so many other things. So I won't take much time. I will give
Yes, Dr. Tulsi will have some very good and very insightful questions. So please listen to those questions, and I would request Dr. Sarath Gopalan to answer them. Being the president of Nutrition Society of India,
I don't know if
I just spare Dr. Viveka from this.
I tried to do that.
But thank you, Dr. Chauhan. So those were some wonderful insights by Dr. Viveka and Dr. Sharad and Dr. Chauhan as well, not to forget my friend Dr. Kalra. And a small plant with big benefits. The pharmacological actions is due to these phyto constituents which have flavonoids, steroids, alkaloids, saponins, polyphenols and other amino acids and hydrocarbons. So let me say that a systemic review, Dr. Chauhan talked about this, the various benefits of the other plants as well. So let me say a systemic review of 44 cities were done, involving about 3,000 patients. And they were investigated for cedar vinegar and for FG, which is fenugreek, cinnamon, curcumin, ginger and saffron. Only the ACV and the fenugreek had substantial benefits in reducing blood sugars and also had some, hypotensive effects and not to forget antioxidant effects as well. I would like to ask Dr. Viveka, how does this have an hypotensive effects? We know it reduces sodium and improves potassium. So, Dr. Viveka?
Yes, I think we have shown the mechanism by which basically being an antioxidant, it releases the nitric oxide, also peripheral vascular dilatation, and that is what is the key ingredient of this, and that is how it will decrease the blood pressure. So, and we know that decreasing the blood sugar, decreasing the triglyceride, decreasing the blood pressure, translate into reduction in cardiovascular event. So I think combination of all these things would work.
So I'd like to ask Dr. Sharad, so what is the exact dose of the fenugreek? Is it 1 to 4 grams or is it 25 grams?
If you are looking,
let me complete, sir.
Yes, sir.
There isn't enough data to suggest that higher doses, are safe to be used. It has some side effects, especially Dr. Viveka probably would endorse me into that it has, if you combine it with antiplaques or anticoagulants, the actions may, be more. So not only that, also with the 10 is the toxic epidermal necrosis, which may be seen in few patients. So not to forget, its value in polycystic ovarian disease, not PCOS. That's a different entity altogether. You see, it has no effects on PCOS, but may have some effects on PCOD. And not to forget, psychologist friend who's left talked about increasing free testosterone level without compromising on the total testosterone level. This data, which was meta-analysis, said there is no proof that it improves insulin secretion, that it reduces HOMA-IR, but I don't know. Talk us through that.
So for a normal individual who is not diabetic, the normal individual in the normal population, the recommended dose is a range between 5 to 10 grams per day.
I thought between 1 to 4 grams, but could range till about 25.
It says 5 to 10.
There is no standardized dose.
Yeah, that data. I'm talking of the Indian data. 5 to 10. But in a diabetic individual, they say at least 25 grams per day along with the anti-diabetic treatment. So there's a difference. It's a 5 times increase between the diabetic. But when you talk of a commercial formulation for general use as a practitioner, as an extract, I still don't have the answer. I've not got the answer. So is 5 grams equivalent to 300 milligrams, or is 25 grams equivalent to 25 milligrams equivalent to 300 milligrams?
They are giving 300 milligrams of the extract.
Yes. Is it equivalent to 5 grams or 25 grams? I don't know.
Which comes from 3 kgs of fenugreek plant. See, this
so
is
when
what,
you look at fenugreek seeds naturally,
this is what I was made to understand by the pharmacy.
So what I would really like to know is from industry, because this is something unique to the organization. How much of the fenugreek seeds, how many grams of the fenugreek seeds are used to make this concentrated extract? Because if the general recommendation is 25 grams for a diabetic, and 5 grams,
25 grams of
seeds, of fenugreek seeds,
not the extract.
Not the extract, natural seed, not extract,
And what is the best time to take this?
30 minutes before
You
food.
said to me after food, I corrected you, I said it's probably to be taken before food.
Yes.
Because best absorbed
Yes.
when you take it in empty stomach.
Absolutely, I go with you.
Yeah.
So it should be, it is confirmed, it should be 30 minutes before meals is what the company actually projects.
So to Dr. Viveka, probably, what about the
I know better.
antiplatelets and anticoagulants? Can we combine this?
Yeah, so I think you can safely combine it with it, but there is no data that
May increase.
no, it doesn't increase. So there are certain medicines which are what we call automatic medicines like anti-diabetics, SGLT2 inhibitors, and similarly, these natural products, they are auto-regulated. So you do not have to,
It has a GRAS, recommendation from the FDA. So generally safe.
Yeah.
Thank you, sir.
Thank you. Thank you, sir.
No, this is not fenugreek plant. Dr. Sen, sir. Your question, please. Sir, Dr. Sen is saying confusion है. Solution कुछ पता नहीं. Solution जो पता चला तो question क्या था पता नहीं.
So his question is that when you combine it with your drinks, alcohol, what is the effect?
So that is between you and me. But other than that, I was just wondering, since this has been there for so many years, and we know that good old digitalis came through from building stuff, and everybody concentrated that. So I was just wondering what is the active alkaloid in fenugreek in the leaf or the seed which is active. and what is the actual therapeutic dose? Since so much of things are being said and there have been so many insightful opinions about what all the herbal products can do, so why don't all the companies get into manufacturing, garlic and fenugreek and anything in dosages of 10, 15, 20 milligrams so as to sort things out for everyone and keep on monitoring so that, for any patient who has undergone a stenting or who has come out from diabetic coma, we can keep on, give a ratified dose of whatever is there. Because till now, as to my little knowledge that I have, CSI or RSCTI doesn't have any recommendations for any of these products.
Yes, I think if you look at what we call good dietary practices, this falls in that group. It's not a, yes, it was, and it is still a pharmaceutical agent. So there is no substitute to good dietary intake. So you should take more fibers, more fruits, more fenugreek seeds and all those things which have been shown to have a good effect. So they are not pharmaceutical agents per se. So the people have seen that, if you consume more of the fenugreek seed, you will take more of arjun bark and all. They have got mild self-limiting effect, positive effect on diabetes and the cardiovascular disease, but they are not panacea for everything. So bottom line is that if you eat well, then probably you might not need the medication. But if you do not eat well, you might need medicine quite early. So it's as simple as that. So your diet will define how early or late you need medications.
Sir, I'm reminded of something when I was a third year student. So I was in Professor R.C. Mishra's Limited NLJP hospital. He was a gastroenterologist. Lalit has gone from here. Unfortunately, even Dr. R.K. Bhargava has gone from here. And sir, one of the new DMs, Professor S.K. Jain, now, is practicing in Moscow. He had just done his DM and joined LNJP as assistant professor along with Professor R.C. Mishra. Professor R.C. Mishra was an old, gold MD medicine, but a thoroughbred gastroenterologist. So there was a patient who was admitted with gastroenteritis, with chronic colitis and ulcerative colitis. And this patient said कि सर ऐसा है कि आपने जो दवाई दी उससे प्रोफेसर आर.सी. मिश्रा को बोला कि आपने जो दवाई दी उससे कोई फायदा नहीं हुआ सर, लेकिन ये डॉक्टर साहब जो हैं चश्मे वाले ये आए थे सर, इन्होंने कहा भैया तुम एक काम करो, तुम बेल का जूस पियो और तुम भैया दही खाओ। तो सर मैंने वो 2 दिन से शुरू किया और सर मेरा मोशन जो है वो बिल्कुल ठीक हो गया। सर मुझे प्रोफेसर R.C. मिश्रा के वो गोल्डन वर्ड्स आज तक याद है। तो उन्होंने डॉक्टर S.K. जैन को बुलाया राउंड पे, उन्होंने बोला डॉक्टर वर यू टॉट दिस ड्यूरिंग योर DM और दिस इज व्हाट योर